founding father of science of epigenetics, Dr. Joel Wallach. This program is for educational purposes only. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. Statements in this program have not been evaluated by the FDA. As an empowered individual, you do have options available. We're honored to continue and share the teachings of the founding father of science of epigenetics, Dr. Joel Wallach. All right, let's open up that waiting room. Open up the doors, actually, to the Zoom meeting. Hello, everybody. My name is Becca Dukes. I am so excited to have you here with us. Welcome, welcome. If you're here live with us, make sure you have that chat open, as we have Marilyn and Phyllis both going to do some tag teaming and making sure that you get all of the information in black and white so that you can, well, they help you take notes. So if you can't write as fast as our speaker, then at least they can type faster and you can get all the information you need there. So I am Becca Dukes. I'm excited to be here. As folks here on this program, we create a space where education, experience, and lived wisdom come together, mind, body, and spirit. And as the Director of Student Services for the Institute of Holistic Health, a certified holistic health coach myself, and also a certified naturopathic practitioner, I'm excited to be able to produce and bring to you a resource that empowers you as an individual. So whether you're a coach or whether you're just somebody seeking information, this program is for you. So if you have any questions and somebody invited you to this program, you want to make sure that you get back with them. They are your number one point of contact, and they cared enough about you to share this information. Return the favor, tell them thank you. And again, they're going to be your first point of contact. Now, if you found us on your own and you have never spoken with anybody about any of the products that we mentioned on this program, then we do have a call team standing by to help at 855-949-3377. Again, 855-949-3377. And if you have any questions about the content of this program, like if we offer something and you want to get a copy of it, questions dailywithdoc.com. Again, that's questions with an S on the end at dailywithdoc.com. Well, folks, today we're just truly honored as we have an extraordinary guest, somebody that I love and appreciate and respect dearly, and that is Dr. Joanne Conaway. So Dr. Joanne Conaway, she is a retired United States Air Force nurse, having served with dedication, discipline, deep compassion in some of the most demanding environments imaginable, folks. Following her military career, she continued her lifelong calling to heal as a naturopathic doctor, focusing on root cause wellness, which is what this program's all about, balance, and supporting the body's innate ability to restore and regulate itself. Today's conversation takes a powerful and timely turn as we explore how we can evict those little critters that may be residing within our body. Now, it used to be called the full moon cleanse, but it has been changed as a dynamic duo parasite cleanse protocol. We're going to be going through that protocol. She's going to be explaining the ins and outs of it, and exactly why and how they put this program together. So, this conversation is about reclaiming your health, working in rhythm with the body, and making space for true renewal, folks. If you have any questions again, and you want any information that is being offered, like your own personal, you got to do it exactly the way it's written, protocol. You can request that by emailing questions at dailywithdoc.com. So, folks, grab your coffee, settle in, and join us for an enlightening discussion as we have Dr. Joanne Conaway. Hello, Dr. Conaway. Thank you so much. I think beginning of the year, people are wanting to make changes. And I can't think of a better time to really dig into this topic today. Thank you. Thank you.
Well, I'm happy to be here, and thank you so much for having me. And you're absolutely right. This time of year is when people want to make changes. This time of year is, for whatever reason, it doesn't happen in June, it doesn't happen in September, but it happens in January. People make the decision they want to start over, they want to take care of themselves. So today, what we're going to talk about is a problem that a lot of people don't recognize as being so significant in this country. Excuse me, when we talk about parasites, for so many years working in the medical field, parasites were something that occurred when people had been to a third world country. Perhaps they had been someplace else, maybe they drank the water, maybe they ate fish that wasn't cooked, maybe they swam in streams. I used to watch a show on TV, and I think it's still on. And the title of it was The Monster Inside Me or The Monster Within Me. I can't remember what, but I found it very fascinating because it was people who had had long-term protracted symptoms that could not be readily identified by mainstream medicine. Docs would treat the symptoms for sometimes several years and never finding the root cause until somebody would make the decision that maybe we should go ahead and call in a tropical medicine doc and see if we've got anything here. And so it was interesting watching that show because so oftentimes, once again, they would talk about people who had had symptoms for years, and doctors would work with the symptoms, never identifying the root cause, right up until they finally made the decision that this person needs to go for psychiatric help because we can't deal with these symptoms. These symptoms are not going away. They're not getting better. What is it about this person that is driving this behavior? And then, as I said, finally, a tropical medicine doc would step in and they would identify parasites. They would treat for the parasites, and lo and behold, the symptoms would get better. The people would get better. So I found it fascinating because, as I said, throughout my entire career in nursing, if a person had parasites, it was always assumed they had been out of this country. The assumption was they had been to a third world country, and that's how they had contracted parasites, because heaven forbid they would contract parasites in the United States. But now, if you look at the research that's out there, there are some researchers that say 85% of us have parasites. There are researchers that say if you're walking, talking, taking nutrition, you have parasites. So literally, so oftentimes when we talk about parasites, people don't like to think about it. They don't like to talk about it. They throw their hands in the air and say, that could never happen to me. I mean, I have a really clean house and I use antibacterial soap and, all of those things. But what we know is parasites come to us by various different means. And one of the biggies is produce coming in from all over the world. When we talk about how we eat the standard American diet or the SAD diet as we have it, is a diet that's loaded with produce and other things that are imported from all over the world. Oftentimes, these critters just hitchhike into our food supply by way of these foods that are delivered from all different parts of the world. So that's one of the ways we get parasites. Interestingly enough, there have been parasites found in some municipal water supplies. Not a pleasant thing to think about. Certainly, if people are drinking from the faucet, which I never recommend, but if people are drinking from the faucet, oftentimes they can encounter various different bacteria and things in that water, but there have been instances where parasites have actually been found. Now, one of the other ways, and this is a way that a lot of people are exposed to parasites that is away from food, okay? I mean, normally when we talk about food, I know that I do a parasite cleanse periodically because I like sushi, I like ceviche, I like those things that are not thoroughly cooked. I know that I'm probably exposing myself to parasites, and from my perspective, better out than in, okay? But our pets very readily share their parasites. And oftentimes people don't think about it. But a good example is if you have an animal, most people who have pets, you know that your vet says you really need to worm your pets at least twice a year. And that's because pets get into everything. And no matter what, they are prone to carrying parasites and sharing parasites. Now, how do our pets share our parasites with us? Well, a pet defecates in the yard, even if you're fastidious about cleaning it up. If you walk barefoot through the yard and you have any type of an open sore on your foot, you're likely to be able to get parasites from what got left behind. The other thing, and a lot of people don't like me talking about this, but the other way that they share their parasites is when they do those little puppy kisses, when animals lick your legs or lick your feet or lick your cheeks, they can share their parasites with you that way. If you allow your pet to sleep on your bed or on your furniture, they can share their parasites in that way. So I'm always very cautious when I work with people because people don't want to hear that. You know, and people who have dogs, oftentimes they have dogs, their loving little dog sleeps with them all night, or, you know, their loving little cat sleeps with them all night. But you have to understand that you're taking a risk. You're taking a risk of exposure to parasites. Now, when we talk about that, there are different ways that we can deal with parasites in animals. That doesn't mean you have to have, in fact, my animals get the GI cleanse every single day, and they have yet to have parasites for that reason. But I still don't allow them to sleep with me in the bed, and I still don't allow them up in the furniture, and I still don't allow them to lick my face and lick my feet, because I know that there's a likelihood that they have parasites and they can share their parasites. So those are a few different ways that parasites can come to us. And so when you think about it like that, and think about the fact that we are, for the most part, all exposed to produce coming in from other countries. We are, for the most part, all exposed to water in some way. Oftentimes we have pets. There are various different ways they can come to us. And so that's one of the reasons why research now says 85% of us have parasites. And as I've said, there are some researchers that say 100% of us have parasites. So given that, a lot of people, first of all, don't want to hear it. They get freaked out when you say to them, well, you may have parasites. But let's think about that for just a minute. It is, in some ways, a frightening consideration to think that I might have something else growing inside me, something else that has made the decision that I am where they want to be and they are taking from me. That whole thought kind of freaks you out. However, given that that might be the case, why wouldn't somebody say, hey, let's just do a parasite cleanse and be done with it? Now, this new parasite cleanse that we have, it's not actually new, it's just the process is a little bit different than the full moon cleanse. We've used the full moon cleanse for many, many years, and now we're using the dynamic duo parasite cleanse protocol. But that cleanse protocol is a protocol that is designed to go after parasites. Doesn't matter what kind of parasites. You know, when we talk about parasites, people oftentimes will think about things like Giardia, or they'll think about tapeworms. We know that tapeworms is a very popular parasite, okay? And we've heard the stories about tapeworms that come out of people that are 25 inches long, and We know that tapeworms can live inside a person for 25 years. They just continue to grow and grow and grow. Pinworms and roundworms and flukes and all of those things could be a part of our everyday lives. And so this particular protocol will actually go after any and all parasites. Now, the fascinating thing is when we talk about parasites, we know that there are things like liver flukes. We know that many parasites impact the gastrointestinal system, but parasites have also occurred in people's brains. Now, this is not a pleasant thing to think about. And I have recently been involved in 3 different situations where these people actually had parasites in the brain. And unfortunately for them, they were those people who had been treated long term, and no one could come up with exactly what had caused the problems, the symptoms. You know, they had dizziness, blurred vision, restlessness, headaches, stiff necks, all kinds of symptoms, and to the point where all 3 were in fact debilitated. They could not hold a job. They couldn't hold a job because they couldn't get a decent night's sleep, and they were just on disability and suffering greatly and could not enjoy life in any way, shape, or form. And so when it was determined that they had parasites in the brain, we used this parasite cleanse, and all 3 of them are now holding down good jobs and leading normally healthy lives. We just had to get rid of the parasites. And so I think it's important for people to realize that they are far more prevalent than we think. They are not just a third world problem. And if you have symptoms that are unexplained, if you have symptoms that keep recurring and you just can't seem to get rid of those symptoms, you need to consider that it's parasites. Now, you all know that I'm heavy on the gut. And when I work with anybody and everybody, I start them out with a gut protocol. It's fascinating to me because so oftentimes what we've learned is if we repeat the gut protocol, sometimes that's what it takes for people's symptoms to go away. And we've had significant success with doing the gut protocol once and then repeating it, in addition to the 90 nutrients, the good food, bad food, those other things that we know are so critically important. But what about those people who do that protocol twice and they still have symptoms? What about those people who do that protocol twice, but they still have skin issues? Well, there's a likelihood that if the protocol has not taken care of their issue, it could well be parasites. And when we talk about the symptoms that are associated with parasites, it's fascinating because so many of them can be the same symptoms that are associated with having an imbalanced gut, having an imbalanced gut microbiome. So I usually start out with the gut protocol. Now, if a person comes to me and tells me that they have been diagnosed with parasites, then I immediately put them on the parasite protocol. And the reason for that is we're not going to be able to affect a change and help these people improve their wellness if they have parasites living inside them. And so I will, in those situations, start out with the parasite protocol. But for the most part, what I have found is people who have all of these chronic symptoms, and this is one of the reasons why I'm a stickler on this. If you have someone who has symptoms and those people are not improving and not getting better, then consider that it could be parasites. Now, in my opinion, you don't necessarily have to go and have the parasites identified. Certainly you can do that. But one of the important things to remember about that is when you go to have testing done for parasites, depending on when you have the testing done, for example, as I said, a lot of parasites impact the gastrointestinal system. So people will submit a stool sample, and that stool sample will be used to determine whether or not they have parasites. Well, interestingly enough, depending upon when the sample was collected, there may be no indication of parasites. And this is one of the things that is a real drawback for many people because they'll say, oh, I had my stool tested and I didn't have parasites. Well, maybe not that particular specimen on that particular day, but that does not mean that you don't have parasites. one of the things that we know is parasites become very active during the full moon. And so when I have people who make the decision that they want to be tested, I encourage them to collect that stool specimen at the time of the full moon. That's when you're going to have the best chance for being able to actually identify whether or not there are parasites. But for the most part, for me, it does not necessarily require testing. If people have chronic symptoms, people have chronic bloating, people have indications that they have some type of inflammation in the colon, people have chronic skin issues that they just cannot get rid of. If people come to me like that, then I suggest that they do this protocol. It's not going to hurt to do the protocol. Sometimes people may experience a die-off reaction, and we'll talk about that in just a few minutes. But usually the way this particular protocol is set up, excuse me, any die-off reaction is minimal. Most people do not have an issue, do not have a problem. But what I also tell people is if you're going to do this protocol and you suspect that you have parasites, don't be too shocked and surprised if you see the parasites, if you see evidence of the parasites in the toilet, if you see evidence of the parasites coming out through your skin. Okay, it doesn't sound pleasant, but better out than in, right? You want to get rid of them. So I caution people and tell them, don't get so upset if you see that these critters are leaving you. It's better that they are leaving you. But again, the thing I want to stress is when people have chronic issues and chronic problems that they just simply cannot identify or get rid of, that's when I consider that it may well be parasites. Now, some people, there are a lot of people out there that say parasites can cause all kinds of issues and problems. I, for one, believe that that's true. When we talk about parasites, what is a parasite? Well, parasite is something that just kind of hitchhikes, okay? Something that comes into you and starts living off you and some of the parasites that are gut parasites, for example, start taking your nutrients. Sometimes people will have issues where they are losing weight for no identifiable reason, or they're trying to lose weight and can't lose weight. These sometimes are symptoms that are associated with having parasites. And so when a person has those long-term symptoms that they just can't seem to recognize or identify, or mainstream medicine can't come up with the answer, then I recommend doing the parasite cleanse. Now, personally, I do the parasite cleanse usually a couple of times a year. And the reason I do is because, as I mentioned, I like ceviche, I like sushi, steak tartare. They are not my mainstay everyday meals, but I do enjoy those things periodically. And because I do recognize that I may in fact be exposing myself to parasites. So again, better out than in. Why not do it? It's not going to hurt you to do it. And so I do recommend that people do it at least once a year. If you are someone who eats foods like that, then perhaps it's best to go ahead and do it twice a year. And it's not going to hurt you to do that. Now, the component parts of this particular protocol, it's interesting because, first of all, before we go any further, does anyone have any questions? Do you have questions that?
It doesn't, we don't, well, actually, we do have a question. And it goes back to, you had mentioned how you give your animals the GI cleanse every day. Brenda wants to know, how do you give a cat the GI cleanse? They use canned food, or do you use by the dropper? How would you give a cat?
I use a dropper. And usually for a cat, depending upon the size of the cat, it's about 4 drops, not droppers, drops, and that should be adequate. Now, if you have a big cat, if you have an adult cat that weighs 10 pounds, then you might want to up it to 6, maybe 8 drops. But my cat gets it on her food every single day, and she has since she was a kitten. She doesn't know any better. That's part of her routine at night. She just gets it dropped on her food. But for her, she's a very small cat. So for her, what I do is I just put 4 drops on her food along with her dusting of Arthrodex. And that's how she gets her parasite cleanse. That's how she gets the
Okay, so a 15-pound cat, you're looking closer to 8 drops.
15-pound cat, you'd be looking at 8 drops, and 8 drops should be sufficient.
Excellent. Awesome. Thank you so very much.
Yeah, and once again, it's drops, not droppers. That's a really
Yes.
important thing. When people are first using the GI cleanse, they've never seen it, never used it before. They read the label and it says droppers, and so they think droppers. Well, no, when we're talking about pets and we're talking about something that weighs no more than 15 pounds, you don't want to give them droppers of the solution. You want to give them drops of the solution. So
Excellent. Excellent. Well, please go ahead and continue. I mean, there's quite a bit to discuss. And you had mentioned if somebody is anemic and there's no evidence of bleeding,
correct.
they could have parasites.
Depending upon the parasite, they could have a parasite. There are parasites who want your nutrition, but there are parasites who attach to you only because they want your blood. And this is another thing. There's a lot of research out there that has shown that people who have chronic anemia, it's not because they aren't eating properly. It's not because they're bleeding somewhere that's identifiable. It's because they have parasites that are sucking their blood. And again, not a pleasant thing to think about. However, if that's the case, let's just get rid of them. I mean, that's my approach.
It's like an internal leech.
Absolutely. And that's exactly what it is. They are actually sucking your blood. And there's so many different types, there's so many different types of worms. Another thing that a lot of people don't realize is bed bugs are parasites. And, bed bugs have been a considerable problem in many parts of this country, hotels and places like that. Bed bugs, not a pleasant thought. Okay. And this is one of the reasons why a lot of times people will have chronic itchy skin, and they're not able to identify what's causing that chronic itchy skin. It doesn't seem to be a problem with dry skin. They take enough essential fatty acids, and they, use good body lotion, and they do all of that stuff, but their skin is itchy. Well, when people come to me and they have that concern, one of my first questions is, have you stayed in a hotel recently? Have you been outside of your home sleeping in a situation where you may have picked up bed bugs? Now, I say outside your home. The unfortunate thing with bed bugs is if you've been in a hotel and you've slept in a bed that has bed bugs, those bed bugs are not only in the bed, they're in the bed, they're in the drapes, they're in the carpeting. And depending upon where you put your suitcase in that room, they're now in your suitcase. You bring them home, and they can be a horrific problem. And so I think it's important for people to realize that this type of a parasite can impact you in a very negative way as well. And we see more and more in terms of the research around this and devices that will help to, in fact, kill the bed bugs or collect the bed bugs or get rid of the bed bugs. The other thing people don't realize when we talk about parasites, people don't oftentimes think about ticks, but ticks are also parasites. And when people are exposed to ticks, if they don't deal with it and do something about it, they can get very, very sick. It doesn't have to be Lyme disease, but they can get very sick with a tick bite. I know that I have an individual friend personally who is a tick magnet. I have a granddaughter who has become a tick magnet. I mean, this child, when she goes out in the yard, it's just horrible. She's only 2 years old, and it's just awful. She's a tick magnet. But when you are dealing with ticks like that, this one friend that I mentioned, whenever this person gets a tick bite, it takes months for the evidence to go away. And this is a person who reacts and responds to tick bites with a raised red area that takes months to go away. But ticks are parasites. And again, what are ticks doing? They're attaching to you and taking a part of you. And so we just have to make sure that we address tick issues as well and recognize that they are, in fact, a parasite. And this is one of the big reasons why my animals get the GI cleanse every single day. I know that where I live, there is constantly an overgrowth of ticks, if you will. They're just there all the time. And because of that, my animals used to have issues bringing them home from the field all the time. So I just make sure that they get the GI cleanse every single day.
That's awesome. Now we have one more question, based on something that you have mentioned. And you had mentioned how the parasites may come out of the skin. Nancy wants to know, do they look like worms where on the body they're likely to come out, or other than the stools?
Okay, it depends on the parasite. Okay, sometimes parasites coming out of the skin can look like little worms. I have seen a situation where a person had parasites in their eyes and it looked like little worms under the whites of their eyes. And that's exactly what it was. Okay, so it depends on the parasite. I have had people who have described to me looking like little worms coming out from under the skin. And that's certainly one way the parasites can present. Oftentimes they look like little flecks or little bitty bugs coming out of the skin. So it depends on the parasite, because parasites can come into the body, and unfortunately they can come in with food, and some of them elect not to hang around in the gastrointestinal system. They sneak out of the gastrointestinal system, and they may take up residence in the area of a joint, for example, and start causing issues and problems in the joint. And so it depends on the parasite, but all kinds of descriptions, not just in the toilet, just,
Oh, absolutely. I have a client in Oregon. She does landscaping and a lot of gardening. And she had sent me some pictures, and there was they almost looked like splinters coming out of her skin, but they were moving.
Yeah.
Because she sent a little video. It was crazy.
Yeah.
And another one in Texas where she had it, and it looked like little flecks of dirt. But then I asked her, I said, okay, can you do a video for about 30 seconds? And sure enough, they were moving.
Those little flecks of dirt were moving. Yeah. Yeah.
It's crazy. Very crazy.
It is. And that's why people get so freaked out about it, I mean, you don't like to think about things crawling out of your skin, but once again, you'd rather have them out than in. So
I absolutely agree. And we're always talking about going organic, non-GMO, grow your own food. Well, there's microorganisms that we want in that garden,
and there are parasites that you want in the garden. If you're going to get a good crop, there are parasites that grow in the soil. And this is one of the reasons why so many times people who are landscapers and people who work in the garden all the time, they just love to feel the dirt under their feet. Well, that's fine and dandy if your feet are in good condition, but if you have any broken skin or any area where a parasite can get in, you can end up with parasites. And that's why when I work with people who garden a lot, myself included, but when I work with people who garden a lot, I make sure they understand the importance of the fact that parasites are necessary. However, make sure that you realize that you could, in fact, be infecting yourself with parasites, and just do a periodic parasite cleanse.
Absolutely. So, Nancy, did you have anything else to add to your question? I see your hand is up. You should be able to unmute. No?
Well,
all right.
Well, I was just wondering, you answered it. I was like, where
I heard you and then I didn't. Did we lose Nancy?
No.
I think we lost Nancy. Well, let's go over. We do have a couple more hands up. Do you want to take a couple more questions? I definitely want to make sure we get to the cleanse itself.
Okay. We've got time for a couple more questions.
Oh, fantastic. All right. Phyllis, what question do you have for us today?
Dr. Conaway, I have a male client. He does have arthritis, and he has he has persistent neck pain. I would say of the symptoms you mentioned, he has a stiff neck, persistent neck pain, may some insomnia, may have an inflamed gut. Now, he was told by a chiropractor that he might have a vagus nerve issue, but I'm wondering about the possibility of parasites. Can you comment on the vagus nerve aspect of that, and would he benefit from this parasite cleanse?
Okay, I find it interesting that the chiropractor identifies it as a potential vagus nerve issue, but what's the chiropractor doing about that? Yeah, well, I mean, one of the things that we talk about a lot, for example, if people have cardiac issues, people have atrial fib or ventricular tachycardia, my recommendation is to go to a chiropractor who can do a good cervical thoracic adjustment, because oftentimes what has happened is the vagus nerve gets pinched off. And oftentimes when the vagus nerve gets pinched off, people will have issues like atrial fibrillation and ventricular tachycardia and